CEO of the Greater Macon. Good morning. I'm Ron Shipman, Interim President and CEO of the Greater Macon Chamber of Commerce. It is my pleasure to welcome the guest panel to the Heal Healthcare Town Hall, a virtual program from the Greater Macon Chamber. We are thrilled to have this opportunity to highlight our Macon Bibb healthcare and wellness nonprofit leaders to highlight the innovative ways they are supporting our community through these unprecedented times. Today's healthcare forum is presented as part of Heal Healthcare series by Atrium Health Navicent. Please welcome Julia Magda of Magda Law, our moderator and past chair of the Greater Macon Chamber.
Thanks, Ron. It is my pleasure to join this important conversation. Our first panelist is Dr. Jimmy Smith, the administrator of the Macon-Bibb County Health Department. Dr. Smith's foundation in health began with an undergraduate degree in biology and chemistry from Johnson C. Smith University in Charlotte, North Carolina, and it has provided him exceptional experiences in the area of general family medicine, public health policy and administration at the federal, district, and local levels, minority health, and health equity and disparity issues. Dr. Smith received his medical degree from Wayne State University and completed residency training at the Southwest Georgia Family Medicine Residency Program in Albany, Georgia. After residency, he was selected as the Education Staff Fellow at the American Academy of Family Physicians in Kansas City. In 2007, he completed the Master of Public Health degree with a concentration in environmental health from Fort Valley State University and has completed graduate courses from educational leadership from Mercer University. His professional experiences include, but are not limited to, academic and public health practices. He has served as the professor of practice for the College of Health Sciences for Argosy University in Atlanta, and adjunct professor roles with Atlanta Metropolitan College and the Department of Community Medicine at Mercer University School of Medicine. He has served as the Deputy Director of Clinical Services for the Fulton County Department of Health and Wellness. Dr. Smith gained federal public health experience while serving as the Special Assistant to the Assistant Secretary for Health and 16th Surgeon General of the United States. From 2012 to 2018, Dr. Smith served as an assistant professor of practice for Mercer University, where he facilitated courses at the undergraduate and graduate levels and served as liaison for the academic health department with the Georgia Department of Public Health, North Central Health District. This relationship was the first of its kind in the state of Georgia, helping to strengthen the links between public health practice and academia and dismantling the separation between the education of public health professionals and the practice of public health by engaging students in real-world public health practice throughout Georgia. Dr. Smith is the former Senior Deputy for Health Science in the Chronic Disease section at the Georgia Department of Public Health. In this role, he was responsible for achieving a team-based environment that supports research, evaluation, and program delivery excellence through support of communities and health districts to reduce the burden of chronic disease and cancer in Georgia. He maintains service to the profession by being an active member of the Community Health Planning and Policy Development section of the American Public Health Association, is the Region 4 representative to the APHA Council of Affiliates, is the current Georgia representative to the APHA Governing Council, is a board member of the Three Rivers Allied Health Education Center, and is site visitor for the Public Health Accreditation Board. Dr. Smith is married to Dr. Yvette Monique Davis Smith, and they have 3 children. Elizabeth, a doctoral candidate at the University of Delaware in the Department of Plant and Soil Science, Amelia, a biomedical engineer with Boston Scientific, and Gordon, a junior psychology major at Morehouse College. We welcome you today, Dr. Smith.
Dr. Smith, can you share your remarks?
Yes. Thank you for that introduction. Certainly, I think the only part of that that probably counts is the last fact that I think I married pretty well and the kids turned out okay. In the last, I'll keep my remarks short just in terms of how we're handling this pandemic. And I would want folks to understand that we're still trying to handle this pandemic. And just to give you a quick picture of what we've done over the last 18 to 24 months. So in the last 18 to 24 months, we've had to move our service delivery from primarily being handled by temporary staff to handle the influx of patients that were coming, to now transitioning that back to our full-time staff. You've seen us move from providing COVID vaccinations in a drive-through tent with 5 bays to now being able to handle that in our center. You've seen us increase our educational efforts throughout the community through social media and particularly interviews in various formats. We've moved from no public health service delivery in terms of communicable disease, family planning, maternal and child health, and many of our immunizations outside of COVID, to now we are back at full operations in addition to still providing COVID testing and vaccinations, with the addition of being able to bring back our travel clinic for international travel, as well as reopening our dental clinic, which had been closed for approximately 2 years and now has the ability to see adults as well as children. And we're able to do this with a staff that is still at 50% of what we're budgeted for. We have certainly increased our marketing as a result of COVID to try to encourage folks to come utilize our services. We've increased our engagement now with health education so that we trying to move more away from holding events to holding things that will engage our community and then empower them over a long period of time. And in the midst of all of that, we actually moved locations in the middle of the pandemic. So for more than 2 decades, public health services were provided at Emory Highway, and now we're in a facility at 1600 Forsyth Street, which I'm proud to say, I don't think there's another health department facility in the state that's as nice as the one that Macon-Bibb County holds. So that's been keeping us just a little busy over the last 18 to 24 months, and I'll certainly turn it back over to Ms. Magda.
Thank you, Dr. Smith, for sharing your insights with our community and for being an inspiring leader during this challenging time. I'm now pleased to introduce Nancy White, who is the Executive Director of Macon Volunteer Clinic, whose mission is to foster primary health care for all working adults in Bibb and Twiggs counties, regardless of insurance or ability to pay. They are powered by philanthropy and the volunteer services of physicians, dentists, and others. All services are at no cost to patients who qualify. Nancy previously worked for Coliseum Health System for 18 years in several capacities. She was also Director of Oncology Services for the Medical Center, now Atrium Health Navicent, for several years. During these years, Nancy was elected 3 times to Macon City Council, which she considers the honor of a lifetime. One of her mayoral appointments was to the Macon-Bibb County Board of Health, where she served for 7 years prior to being appointed as administrator, the position that Dr. Smith now holds. Nancy has an associate degree in nursing, a bachelor's in English, and 2 master's degrees, one in public administration and the other in professional communications. She is a longtime member of the Macon Rotary Club, where she has served 2 board terms. She is chair of the Bibb County DFACS Advisory Board and was appointed by the governor to the state DFACS Advisory Board. She serves on the Clayton and Carol Paul Fund for Animal Welfare Board and is active with Christ Episcopal Church. Nancy and her husband Jeff have a 28-year-old son, John, who lives in Austin, Texas. Thank you for being here today, Nancy, and we look forward to hearing from you.
Thank you, Julia. As you so well said, and I think the community knows that Macon Volunteer Clinic has been a safety net agency for Macon-Bibb County since 2003. And lack of health insurance is the single greatest impediment to access to healthcare in the United States. People in our country who are uninsured are less likely to receive medical care. They're much more likely to die early, and they're much more likely to have poor health status. So our mission from the beginning has been to ensure, as you stated, that all working adults in our community, regardless of insurance or ability to pay, can get primary health care. And beyond that, we're really committed to providing whole person health care so that we can take on and consider the social determinants of health as well as health disparities, which I think this pandemic has really accentuated. That we have been on the front lines for 19 years, making sure access to healthcare is a reality, is really a testament to the values and the generosity of our community, because we're 100% philanthropy funded and we're volunteer powered, and all of our services are at no cost to those adults, those working adults in our community who qualify. Thank you.
Thanks for joining us today. We appreciate your dedication and that of Macon Volunteer Clinic to the well-being of our community. We're equally grateful for your leadership guidance as a member of the Greater Macon Board of Directors, Greater Macon Chamber Board of Directors. Our final guest is Patty Gibbs. Patty is the Executive Director and CEO of the Family Counseling Center of Central Georgia. Family counseling was established in 1957 and serves moderate to no income clients in a 14-county area. Patty was born and raised in South Florida, attending college and graduate school in Minnesota. One day I want to talk to you about that, Patty. She holds a bachelor's in education and a master's degree in organizational leadership. Patty has over 30 years of executive experience in higher education, serving in the role of dean and vice president at 3 women's colleges across the country. Having been in Macon since 2003, she serves on many boards in the Central Georgia area, including the International Cherry Blossom Festival, Up and Out, the SPLOST Advisory Committee, and Visit Macon, just to name a few. Welcome today, Patty. I'm glad that you could be part of this panel, and I look forward to hearing from you.
Thank you, Julia. And I am thrilled to be on this panel with such distinguished other guest speakers. So thank you for having me. As you mentioned, the Family Counseling Center was established in 1957. And so we've been doing our work for 65 years here in the Central Georgia area. We do focus on the moderate to no income clients here in the Central Georgia area because they're part of our core mission. That's always been what we were established to do. And about 85% of all of our clients pay nothing for the services we provide. So we're providing mental health counseling here in our community. And as you know, the pandemic really has affected us very negatively in terms of our own mental health. But what it's also established was an opportunity for us to take the time to consider our mental health as well as our physical health. And so it really, in some ways, has been a gift, I think, to many people to understand that mental health is about your wellness and it's mental wellness. We are very proud to also be the only nonprofit in the Central Georgia area that provides counseling for victims of crime, as well as folks that are receiving any government assistance free of charge. And so that's really important to us. And we want to make sure that that word gets out, that we are available to help folks. We do all kinds of different things which people don't know about. We also provide adoption services. We do those home visits for adoptions. We also have a course that we call Families in Transition for couples that are divorcing, and then how to work with your children around the issues of divorce, and many things. So we do provide individual counseling, family counseling, couples counseling, and also we work with children and youth. So I'm happy to be here, and thank you so much for having me.
Of course, thank you for your thoughtful comments and updates. On behalf of our chamber members, I would like to pose a few questions now to each of you, and you'll each take a moment to respond to that. So some of you have already touched on this about how the COVID-19 pandemic experience has affected the healthcare community. What else can we do to evolve and operate, and how can we unify our efforts as a community to move us forward coming out of the pandemic?
I'd be happy to go first. I really feel like the pandemic put a magnifying glass on the challenges of healthcare, in particular, health inequities, because we really saw a disproportionate burden of COVID-19 deaths on some racial and ethnic minority groups. And I feel like that might be one of the biggest unified efforts that we could work on as we move forward. Care has to happen where health happens, which is in our homes and in our communities. So my hope is that we unify on the importance of health equity as we move forward from this pandemic.
Dr. Smith, would you like to go next?
Sure. I'd like to add to that one, particularly since this is a chamber hosted event, that I think we also need to recognize that healthcare is a business, but we also have to acknowledge that a healthy business cannot exist in a sick society. So I think that speaks to the things that Ms. White had mentioned. Two things that I'd really like to bring to bear. One, I think developing some common health goals for our community. And this is just an idea of something called like making 30 for 30. Are there 30 health goals that we can either reduce by 50% or eliminate by the year 2030? And I don't think that's too lofty a goal for us to reach with all the resources we have. And then the last one is realizing that our Macon community sits within a region that is served by our healthcare resources. So we need to think regionally, but also recognize that in all of our county comprehensive plans, health is not a required component. So, economy, education, those things are listed, but health is not.
All right, Patty, do you have something to add?
Absolutely. I think that the COVID-19 helped us deliver healthcare in multiple ways. I think all of us probably moved into some telehealth during that period of time. And so now we're able to provide access in ways that might be more accommodating to people. And I think we've also need to continue as a group to connect the physical health and the mental health and really get some help from our physicians that are in our community to recognize issues that may arise with their patients, and especially children. There's some trauma associated with the pandemic for children. And so if we can identify some of those issues early on when they're doing their pediatric visits and get them the help that they need, I think that would be important. We've also seen a huge increase in adolescent and young adult suicide over the past decade. And so we need to make sure that we're trying to break down that stigma that goes with mental health counseling. It's very important that we get those messages out. And our school system is working on that here in Bibb County and the surrounding counties, and that's a good thing. But we need to continue to do that, even in our businesses, that we make sure that we're taking care of our people. Their wellness, their whole wellness, their whole person. And so that would be something that we can unify in about just making people aware about their physical and mental health.
I think all of you have at one point or another today touched on health equity and how that remains a critical concern. What can the average community member do to support this effort to serve marginalized residents in Macon-Bibb? Why don't we start with you, Dr. Smith?
I think what we could do as a community is one, let's frame the question just a little differently so that we don't make such a huge distinction between those that are marginalized and those that may not be classified as such. And the reason I would do that in health is because COVID has shown us, more so than anything else, that health can be the great equalizer. It didn't matter whether you had a large income or you were at the bottom of the socioeconomic scale. We were all in this, I'll say we were all in the storm together, but we weathered it through different boats. So I think from an equity standpoint, trying to frame that question a little differently. I think COVID has also shown us that to address health equity, as both panelists have said, we really need to look at those social determinants of health and address them collectively. And the other part of that, which I think we'll be reminded of, is when our county health rankings come out, those annual county health rankings that are released, we tend to find that our county ranks toward the bottom in Georgia. But keep in mind that 80% of the methodology used to get those rankings has nothing to do with clinical care. It goes back to the violence in our community, educational system, social constructs, for which in many cases our clinical services cannot reach.
All right. You're muted.
Thank you, Dr. Smith. You're so right. I'm so glad you asked that question, Julia. It's the social determinants of health that we really need to address as a community to address, the inequities we have. My dream would be for whether it's the Chamber of Commerce that leads this or the healthcare systems or who, but I would love for us to see a health in all policies community evolve. It would take a multidisciplinary steering committee across all spectrums to make this happen, but other communities have. And in this regard, whether it's the Housing Authority or the Macon Transit Authority or the Health Department or the Macon Chamber of Commerce, the hospitals, it's a multidisciplinary approach to impact the social determinants of health, which, as Dr. Smith said, it's not the hospital system, it's what happens in your housing, access to fresh foods, can you exercise, what kind of job do you have with benefits that you can get off to go to the doctor, do you have health insurance? It is such a cross-section that I think as a community, we're going to have to come together and address if we want to move the needle on inequities in our community.
Patty?
As Dr. Smith has mentioned, their poor health is connected also with poor mental health. And I think that, regardless of whether we talk about people as low income, marginalized, however, it's really across the whole, everyone needs to think about their wellness and that the connection between mind and body exists. And there's research that tells us that. And if we don't manage those things as they become chronic throughout our lifespan. And so one thing that we can do, I think, as a community is listen to what people are saying and then help guide them to the resources that are available. We have a community of people, whether they're nonprofit organizations or for-profit organizations, that are here to support every individual in our community. But sometimes we forget that we can be that conduit to refer people and find them those resources that they need for their own personal wellness. And some people sitting down and having a counseling session is important to them. Others may just need stress release and an activity to engage in. Others need to go actually to the doctor and be seen for a medical condition. And so we need to support people in doing that. And I think one of our greatest challenges for our community is transportation to and from those appointments. That becomes a real challenge, I think, in our community, and especially for those that are considered low income and that we're talking about as being marginalized, they have less resources and less access to transportation to get them to the places they need to go.
Thank you all. All right, I'm going to put you back on the front burner, Patty, and start with you on this question. We've already talked about the high level of stress and that you're working understaffed in all of your facilities due to the pandemic. But this stress on frontline workers, including healthcare professionals, is really bubbling to the surface now. And in July, there's going to be a new national suicide hotline expected to launch. The lawmakers are working on passing the Lorna Breen Healthcare Provider Protection Act, which is named after a physician who committed suicide. So how are your staffs and volunteers managing this unprecedented demand on their own mental health, even as they help other people with their physical and mental health? So I'll start with you, being the mental health professional here today.
You know, one of the things that we were lucky enough to do is be able to move to telehealth when the pandemic hit. And so we were able to continue to provide mental health services. The challenge we faced there was access. Many of our clients did not have consistent Wi-Fi or internet access, or even equipment, you know, cell phones that weren't consistently connected places. So we lost a number of our clients. Well, that then created a gap in service. But we also think about all of our frontline workers and the worry that they had about bringing home COVID to their families, that emotional and physical exhaustion that they experienced. They couldn't leave their jobs. Some of us could go home and work. That we need to remember to give emotional support. Some of the things that we have tried to do is really encouraging that work-life balance with our staff, for sure. Limiting the number of clients that they see in a day to help manage that exhaustion and those feelings of feeling overwhelmed by the information that's coming in. And also to provide some group sessions, because that way we can work with more people and be able to serve them. So using technology, we are available to do both telehealth as well as in person now. And I think that's important. A way that we're able to deliver healthcare services has changed a lot since the pandemic. It hasn't lessened the stress on people that are delivering those healthcare services. And in fact, not having enough staff, I think that Dr. Smith mentioned this. If we're not working at 100% capacity, we have a lot of clients that are coming in and need appointments, and it's hard to keep that consistency. And so really paying attention to our staff and making sure that they have those breaks, that's the only way that we're going to be able to help support them in what they're doing, because it really is exhausting to work with folks on a day in and day out basis about their health and their well-being. And it's overwhelming right now. And we're hearing a lot of difficult things right now. And for us, we saw an increase of 48% on child abuse from our clients. And so we're concerned, and we think that's going to last probably the next 10 years of hearing those kind of increases in trauma that people have experienced during this time. So really helping our staff so that they can be as supportive as possible to our clients.
Nancy, you want to go next?
Sure. You know, I would say that these unprecedented demands on the healthcare worker is probably focused mostly in the inpatient hospital arena, where, as Patty alluded to, the long shifts, sometimes working a double because of staff shortages. When you're at a primary care medical home like our clinic is, you know, we can do remote telehealth because we're not taking care of patients on ventilators in those high-risk situations. So I think that is where this high stress burnout really takes place. Our challenges from the pandemic are increasingly difficult for us to replace staff when there is attrition. And of course, as a safety net nonprofit, we're already resource challenged. You know, we have the minimal infrastructure in place to maintain a clinic while we're mostly volunteer driven. So that in itself, you know, you're usually under resourced, you tend to acclimate yourself, so to speak, to those conditions.
Dr. Smith?
Certainly, I would ditto everything, particularly Ms. Gibbs has said, and I was taking notes as to some of her responses because I certainly need those where we are. In the last year, we've certainly seen more advertisements from our Human Resources Office offering our employee assistance program to our staff members to help with stress. I have seen more of our staff members rely on their faith of different denominations to help get them through the stress that they're feeling, because it's not only the stress of dealing with patients that need services, but it's also doing that while you know that you're putting yourself at risk. And, you know, as Ms. White said, we're a small facility, but you're trying not to get COVID or not get ill yourself. You're trying not to bring something home to a family member. You're also the one that are getting the questions from other family members or community members about what they should do. Also, we are working on partnering with the effort by our county commission as it deals with mental health to bring some of those support groups and resources to the health department in the next couple of months. And then also we deal with the stress as we can of, say, those unfunded mandates that came with COVID. So one of the things is not only providing COVID vaccines at the office, but we were also tasked with providing vaccines for the homebound. So that became stressful because you knew you were walking into a house where possibly someone could have it, or you don't know the ins and outs of that home. But then also what our nurses noted were, again, those social determinants of health, those other needs of being able to get out and do that traditional public health nursing of going into the homes and seeing what other folks needed. And that in some cases added additional stress to our team members.
Well, I want to close with a final question. Nancy already mentioned the chamber perhaps being part of a multidisciplinary approach to health and all policies across the community. Can you identify something else that the chamber can do to help you in your delivery of healthcare to our community? Whether it's workforce, recruiting talented, individuals to your community, helping with health and all policies. What examples do you have?
A strong business climate strengthens safety net agencies such as Macon Volunteer Clinic, and we would not exist were it not for the business support throughout this community. And, I guess from my perspective, I'm grateful to be serving on the chamber board. I hope that all the chamber members who may contract employees that don't have health insurance, who have part-time employees that don't qualify for benefits, that they'll refer them to Macon Volunteer Clinic, because that's our raison d'etre. We want to serve them and strengthen the community as a whole, because again, when working adults don't have to choose between going to the doctor and getting their medicines versus, a food and a place to live, it's a win for our entire community. So again, the strong business, the greater the strength of our safety nets.
I would certainly add to that and encourage our local businesses to use the services of the public health department. We serve the entire population. I joke with my friends that are practicing medicine that I applaud them for doing that. But I have the largest practice in the county. with 157,000 people to take care of every day. And those are the ones that just live here. That we also are responsible for the ones that are passing, that visit here, that work here, that play here, that pray here. So I think utilizing our services, and if you're unfamiliar with those services, visiting our website or just giving me a call, and I'll be glad to reach out to businesses to say, hey, you may not be able to provide this through your insurance, but we have a program that your staff members may qualify for. I would encourage our businesses to improve the health and well-being of their employees by looking at their employee wellness, maybe policies. I would also ask that help facilitate our public-private partnership that we can generate across our community to address the problems that Ms. Gibbs and Ms. White have talked about. And then also use our academic resources here within the community. Our health department is considered an academic health department because of our formal relationship with Mercer's College of Health Professions. So that now gives me access to undergraduate, undergraduate, master's level, as well as doctoral level public health students. So they are actively looking for projects to work on, and it may be a partnership between the three of us to address some of those employee wellness concerns that could move us forward.
Thank you, Patty.
Well, I certainly would echo what Nancy and Jimmy have said. I strongly support those employee assistance programs because they do allow access to all different kinds of supports. And so I encourage people to go back and review what theirs might be and really talk with their staff about it. And those that are the smaller businesses that are members of the chamber that may not have access to an employee assistance program, partner with us, not only family counseling, but partner with the Macon Volunteer Clinic, partner with public health. I mean, we can work with you to be able to provide very reasonable access and affordable access to our services. And so we want to do that. And I think that's really important because we value every one of our employees. Right now, it's difficult to find staff members and to fill those spots. And so some of the incentives and things that will help us maintain and keep people are some of the services that can be provided for them. And it doesn't have to cost a lot of money to the businesses. And so that's one way that the chamber can partner with nonprofits that do services and provide those kind of employee assistance programs and services for various businesses. So I think what we're trying to tell you, I think in general, is that we are here to help the wellness of your employees and to keep your business going the way that you want your business to go and to keep growing. And we can help support that if you need us.
All right, well, if there's anybody that wants to make a closing comment, the floor is yours. But if not, I'm going to kick it back to our illustrious leader, Ron Shipman.
Thank you, Julia. Any comments by any of the panelists? Okay, hearing none. One, I want to thank everyone for your insight and for taking this time away from your critical missions to educate and inform our members and our community. We also want to show our appreciation again to Atrium Health Navicent for presenting this important HEAL Forum. Additional support for the HEAL Healthcare Series is provided by the Houston Clinic, Central Georgia Cancer Care, Internal Medicine Associates, and Skin Care Physicians of Georgia. Thanks to everyone for being here. Thank you for your participation, and have a healthy Chamber of Commerce Day.